Hello, my name is Dr. Amanda Reimann. I work at ATUNE Health Centres as a medical herbalist and a nutritionist. For the past couple of years, I've been working particularly with patients who have cancer, who have a diagnosis, and have been going through chemotherapy or radiation therapy. So I do a lot of work in supporting them through these difficult stages, supporting their immune system in particular, giving them some diet and lifestyle tips to really help them get through their chemo or radiation therapy in an optimal health state. Okay, so number one, avoiding caffeine is really important because caffeine is a diuretic. We get rid of more water from our body, and it also makes our body more acidic, which is what we don't want. Another important thing is to avoid strong smelling foods. So particularly when you're going through chemotherapy with the nausea, if you are also smelling strong foods, then that can make your nausea worse. So we want to try and avoid that. Trying to avoid always eating your favourite foods, because you can end up with an intolerance to them, and you can also become nauseous to your favourite food. So try and eat a variety of foods. Avoid refined sugars, and these are things like in cordial soft drinks as well, not just cakes and pastries and lollies, but also in the other hidden sugars. Sugar does influence our body. It influences our immune system, suppresses our immune system, makes our body more acidic, and it is not good when we have a diagnosis of cancer to be feeding our body with refined sugars. So another thing to do is to avoid too much contact with germs in the environment, of course, so avoiding too much contact with people who are already immune suppressed, if they've got colds, if they've got flus, and also making sure that you're really strict with your hygiene at home, so making sure you're washing your vegetables really well, making sure that food is cooked thoroughly is also really important. Some other tips: try not to nap too much during the day, because we need to have that regular rhythm of sleep and wake. That cycle is important for us so that we sleep properly at night. And exercise. Yes, it's a big word, it's hard to do, but it's really important, even if it just means going out and just going for a walk, or just going and getting your letters from the letterbox, go with a friend, and ideally go in the sun, even if you do just 10 minutes a day. It's great, it's very important, and there is research behind the importance of exercise even during chemotherapy and radiation therapy. Another important point: try not to isolate yourself from others. Join up with a support group. There are plenty of people out there to help, and talk to your friends, talk to people that you know and that you trust about the things that are going through your mind. So some things to avoid have all been mentioned there, and now I'll just throw in a few tips as well. So if you suck on some ice cubes during chemotherapy, this can also help to just clean the palate, refresh your mouth, and help just to treat that nausea as well. Other important things are to make sure you're getting enough protein in your diet. Get your protein from really high quality sources like lean meats, poultry, eggs, organic where possible, of course. Legumes are great, very, very important especially for cancers of the digestive tract. Making sure that you also include anti-inflammatory spices like ginger, turmeric, galangal, oregano, thyme are antimicrobial. So